Thanks so much, Heidi. Well, today we're joined by Catherine Wells. She's the Director of Public Health here in the city of Lubbock, and we're talking about what you and your family can do to prevent your chances of, well, really just kind of make sure that you're tackling some techniques to prevent yourself and your family from all kinds of diseases, not just the corona disease, but let's face it, people are looking for sanitizer and all these different things and hopeful that that might help prevent some things. But without it in stores, what can we do? So thank you for coming and helping to kind of clear the air for us.
Even for people that can't find hand sanitizer, we still have soap and water.
Okay.
We still have soap and water, and that's really the key to keeping keeping your hands clean, making sure that we're not passing any infection between ourselves, our family, and our friends. So it's really good hand washing. We can't say that enough. It's just hand washing, and hand washing.
Well, I mean, we're blessed. Right now, currently, there is no one in our city and in our county with the coronavirus, but we are hearing that those numbers are increasing just about every day.
Yes.
So for those families that are concerned out there, what should they really be concerned about, and what should they be trying to do for their family?
Okay. Really, the risk to individuals in Lubbock remains low. We're really those that are at highest risk are those that have traveled to areas where there's sustained community transmission. That means that we're finding individuals that have not traveled or haven't had any contact with anybody, and they've tested positive.
Okay.
So really we're looking at the countries of China, South Korea, Iran, and Italy, and then we're starting to see a little bit more transition in California and Washington State. But we have not seen any transmission like that in Texas. We have 3 positive cases in Texas, but all of those cases are associated with travelers.
Okay. So their association with travel means that they weren't attracting this just here within the country. They were actually traveling.
Yeah.
So for us who may be traveling, are there some concerns that we should be thinking about? Is there things that we can be doing to kind of prevent ourselves and not have us be at such risk?
Yeah, the big concern right now is international travel.
Okay.
So if you're traveling for vacation, spring break's coming up in 2 weeks, go ahead and check the CDC website.
Okay.
There are travel advisories there, and it will tell you what precautions you should take for the different countries that you may be coming to. And then we're also recommending that anybody that returns from travel to go ahead and self-isolate as a precaution.
Okay.
That means stay home, stay off of work if you can, avoid public gatherings, and really just keep to yourself during that incubation period of 2 to 14 days to make sure that they don't have the disease and then they don't infect anybody else.
Right. So within that 2 to 14 hour or 14-day time period is when symptoms would occur.
Yes.
And at that time they need to go and
so this is a new virus, so every day we're getting more and more information, but right now all of the studies and all of the data are showing that the incubation period is 2 to 14 days, and that's the window where we're concerned that someone that has been exposed might develop symptoms.
Makes a lot of sense.
Yeah.
So keep washing those hands, right?
Keep washing your hands, sanitize surfaces, anything you would do for cold, flu. And especially the other thing is if you're sick, stay home.
Okay.
And also, we're still in flu season, so it's not too late to get that flu shot if you haven't had it.
And vaccinations as well.
Yes.
Thank you so much.
Thank you.
This was great information. We'll be right back with more Trends and Friends.